Well, healthcare on demand, like a streaming service for medicine. You can access it anytime, anywhere.
But you'll also be paying a subscription fee for it. It's called concierge medicine. It's essentially like having a doctor on retainer for a monthly fee. The concept isn't new, but it is gaining traction across the nation and right here in Metro Detroit. I wanted to know more about this new approach to healing, so I talked to patients and doctors about the future of this healthcare model. Like a 24-hour customer service line.
What I am is I'm an on-call consultant for my patients.
Dr. David Weissman is always one phone call away.
I'm just going to look in your ears for a second.
Weissman, one of a growing number of doctors in the country practicing what's called concierge medicine.
What it is it's a chance for people who need to have more time with their doctor. People who have complicated situations, they have a number of medical problems, they feel like they go to the doctor and the doctor only has time to deal with one or two problems at a time.
And that access comes with a price tag in the form of a monthly subscription fee separate from insurance.
Currently it's $1,800 per year per patient. It works out to be $150 a month or $5 a day.
I know that all the doctors do their very best. I think if you're lucky enough to be able to do this, then absolutely go for it.
Karen Rook, taking part in concierge medical services for the last few years. How do you feel this kind of medical model has changed your health, if at all?
I think it has, because I've been able to sort out other medical problems that aren't really that important.
And concierge medicine is only growing. This particular medical sector is expected to grow by 10.4% annually through 2030.
Each of our doctors takes care of no more than 500 patients, whereas in the traditional healthcare setting, a primary care doctor will have 2,500 patients or more.
Dr. John Blanchard is the CEO at Premier Private Physicians in Troy, one of the first concierge medical practices in the nation. What kind of patients are you seeing that are most attracted to this kind of service?
There are groups of people who really find that they can't get their needs met in that traditional healthcare setting. That's those real complex older patients, for example, the executives from companies that need the access and convenience because their schedules are so full. Or people that just really want to focus on lifestyle.
Blanchard says for him, it's about building a relationship with his patients to better tailor their health care.
People spend a lot more money on a lot less important things.
Where do you see concierge medicine as its own entity in the industry? Where do you see that going in the next 10 years?
There are going to be some changes in terms of the economics of healthcare, but there are always going to be some people who want a little extra special attention.
Yeah, one of the more interesting things that one of the doctors said, he kind of compared it to car insurance. You know, you pay monthly for your car insurance, but when your tires go out, you still pay that out of pocket. So it's kind of like that coupled with having medical insurance. Very interesting stuff.
Absolutely, and what a luxury to have as much time as you want with the doctor, that you can just reach out to the doctor anytime, because I know a lot of us are used to feeling like it's just a rat race and we're just in and out of there as fast as we can go.
On average, they were telling me that most doctors only have about 10 to 15 minutes for a patient. They take an hour with each patient.
And on call.
Trade-offs. Yep, exactly.
Big difference.